Good afternoon to everyone. I am Elango from Trichy. This is the third video on CPR, cardiopulmonary resuscitation. In this third video, I would like to tell you a few important points about the foreign body obstruction. As a first aider, you need to observe the patient, understand about what happened for the patient, and remove the obstruction. So these are all the instructions given in this video. Just watch it and take a notes if you want. This is obstruction symptoms you can see with the patient. So patient is holding the neck and there is a breathing difficulties. Both hands are holded on the neck and patient is suffering. In this situation, as a universal, these are all the universal signs you can say. And to the client, as a first aider, you must ask one single question. Are you choking? You should ask the client, are you choking? Whether you are receiving the answer or not, that is different. But you need to ask the question. If the patient is able to show some body language, then you can understand this is choking. So encourage to cough immediately. Then if the patient is unconscious, immediately if the adult is unconscious, then you can call for the help and use a jaw lift and do your finger sweep from the oral cavity, and you can remove the foreign body if it is there and obstructed the airways. This is actually about the subdiaphragmatic abdominal thrust, otherwise known as leech maneuver. Tell me, leech maneuver. Leech maneuver. Tell me, this is subdiaphragmatic abdominal thrust. If the patient is got any obstruction in the throat, then through this leech maneuver, this pressure gives some more pressure to the lungs, and that foreign body comes out through the oral cavity. And this is the way you need to give the subdiaphragmatic abdominal thrust for the conscious patient or sometimes unconscious patient. Make the patient into lying down and in the supine position. Just sit on the patient's lap and use your both hand and keep your hand on the epigastric region and just give the gentle pressure over the epigastric region. That pressure gives the extra pressure to the lungs, and that motivate the patient to adjust it. The foreign body comes out through the oral cavity. This is the way you have to give the subdiaphragmatic abdominal thrust. This is also called leech maneuver. And this is the way you have to take the foreign bodies by your fingers. The left hand should hold the patient's oral cavity and just to split the jaw, and use your another hand to find the foreign body and take it out immediately. The patient can take a deep breath immediately after you taken the foreign body from the throat. So the first pictures can explain very easily about how to expand, how to open the mouth. So use your thumb and index finger and just expand the mouth, and use your another hand to insert inside to remove the foreign body from the throat. All right. Okay. So for the pregnant lady, you can give the compression to take out the foreign body from the throat. This is the chest thrust. It is also called chest thrust. So for unconscious patient, just to make the patient in a supine position and give the pressure, this is a way you can give the thrust. This is called chest thrust. Tell me, this is called chest thrust. Previously we were discussed about the abdominal thrust, subdiaphragmatic thrust, and this is third one about the chest thrust. Okay. So for a child, those who are conscious, they can stand and you can give the leech maneuver, that is abdominal thrust, to remove the foreign body from the throat. There is also a Heimlich maneuver for the conscious or unconscious child. Sit on the lap, same thing. Keep both hands on the epigastric region of the client and just give the gentle pressure to remove the foreign body from the throat. And this is the way to hold the baby to remove the foreign bodies. Usually the baby a habit of taking chewing some foreign bodies, some articles in their oral cavity. Sometimes that may obstruct, and immediately make the baby in this position. Keep the baby in this position. Hold the baby in your left hand and just tap the baby's backside with your right hand. And the baby should be in the head should be in the lower side than the buttocks. This is otherwise known as back blow. Back blow. So this is the one which gives a chest thrust for the infant, below 1 year. So holding the baby with your left hand and lie down on your lap and just feel the rib margin and find the sternum, especially lower 1/3 of the sternum. If you find that, you can start to give the CPR if the patient is unconscious. So this is my last video in the CPR. So this is the way you have to attend the cases and revive the cases. My best wishes to all nursing students in this time. If you want to contact me, you can contact through my email and my phone number that I have already given in various videos that you can find it. Thank you so much for watching. Bye.